Hello people, my name is Hryhoriy Kostromin. Today we are going to talk about chronic venous disease. For a better understanding of the physiological processes that occur in the development of chronic venous disease, I want to recall the anatomy of veins of the lower extremities. As you may see on this slide, the lower extremities have subcutaneous veins, vena saphena magna and vena saphena parva, deep veins, which similar to arteries, and perforating veins between subcutaneous and deep veins. All of those veins contain valves which send blood in a central direction. Physiology of venous outflow of the lower extremities depends on muscle function and venous waves function of the leg. The normal venous pressure is about 80 to 90 millimeters mercury. The contraction of the calm muscles during walking leads to an increase in pressure in the deep veins. As a result, blood is pushed into a central direction, and normally functioning valves prevent its return. Deep and subcutaneous veins become empty and the pressure in them decreases to 30 millimeters mercury and less. The pathophysiology of chronic venous disease is based on three mechanisms. There are reflux, venous occlusion, and dysfunction of the muscular venous pump. The hypertension develops as a result of these three dysfunctions. Hypertension is the high level of venous hypertension that has existed for a long time. It develops into clinical symptoms. Please pay attention to the classification of chronic venous diseases. CEAP is an international classification of chronic venous diseases made in 1994 by the group of experts of the American Phlebological Forum and includes clinical section, etiological section, anatomy section, and pathophysiological section. Classification includes 7 clinical classes from C0 to C6 according to manifestation of disease. There are a lot of risk factors of development of chronic venous disease. There are age older than 40 years old, obesity, chronic venous disease in close relatives, history of deep vein thrombosis, smoking, and some specific risk factors, menopause, history of pregnancy, and low physical activity. Here you may see different symptoms of chronic venous disease: varicose vein transformation, edema, pain, trophic ulcer, venous eczema, skin hyperpigmentation, white skin atrophy, lipodermosclerosis, itch, a feeling of heaviness, and skin irritation. Inflammation plays the most important role in the development of chronic venous disease. Their expressiveness of symptoms and their frequency increase according to the clinical class of CEP. Diagnostic of chronic venous disease is based on clinical examination, collection of complaints and anamnesis, palpation, performance of functional tests, laboratory tests, general clinic studies, and D-dimer, and the most important instrumental diagnostics, ultrasound, Dopplerography, ascending and descending phlebography, computed tomography, and some others. Ultrasound angioscanning is the main diagnostic method for examining patient with chronic venous disease. Ultrasound and angioscanning helps to verify reflux of the venous valve and venous thrombosis. Reflux with more than 0.5 seconds is considered to be pathological. There are a lot of ways of treatment to those diseases. There are modern drugs, compression knitwear, minimally invasive methods, and classical surgery methods. First, let's speak about diet, mode, and drugs. The patient with CVD don't need special diet, but they should avoid staying in a vertical position. There are a lot of drugs we have for treat these patients. Flavonoids, for example, venous meal, Vazacate, Detralex, saponins, Escuzan, Venitan, and synthetic substance, proctaglyvenol, and combined drugs, cyclo-3-fort, for example. Medical compression knitwear is divided into classes according to the strengths of compression and is used for different clinical classes of chronic venous diseases. Minimally invasive methods are the most used methods nowadays. Scleroobliteration. Doctors inject special medical acid into the vein, and then the vein go closed. Endovenous laser coagulation is a method then the laser inflammation is used for obliteration vein. Radiofrequency obliteration is the method similar to the laser coagulation, but here doctors use special radiofrequency irradiator. And last one, the cyanoacrylate glue embolization is using medical glue for closing varicose vein. And in the end, some words about the classical surgery methods. Crossectomy, Trianov-Trendelenburg operation, is the surgical method of treatment varicose vein by ligation of the large saphenous vein. Venectomy of a large and small saphenous vein, Babcock operation, segmental removal of changed veins, Narat operation, ligation of perforating veins, Linton's and Cox's operation, miniphlebectomy, and endoscopic ligation of perforating veins. Thank you very much.